Hi, this is Susie again. Today I'm going to talk to you about Sjogren syndrome. The definition of Sjogren syndrome is a chronic autoimmune disorder characterized by dry eyes and dry mouth, often affecting other moisture-producing glands in the body. This is why my voice sounds so gravelly most of the time. The immune system mistakenly attacks the glands that produce moisture, leading to significant dryness in various parts of the body, particularly the eyes and mouth. It can occur alone or alongside other autoimmune diseases, and the most common side effects are dry eyes, dry mouth as well. So your eyes, they're burning or gritty sensation, sensitivity to light and blurred vision, dry mouth, a feeling of dryness, difficulty swallowing, that's a hard one for me lately, and increased dental cavities due to reduced saliva production. I've lost 2 teeth so far. Other symptoms, which gets me the most really, is fatigue, joint pain, and dryness in other areas such as the nose, throat, vagina, muscle and joint pain, trouble sleeping, eye discomfort, brain fog, chronic cough, numbness in the arms and legs, feeling tired, thyroid problems. It really can seriously affect other organ systems such as lung, liver, pancreas, kidneys, brain, and nervous systems. So what were my experience? What did it tell me in my symptoms? Although I noticed changes in my skin, mouth, eyes, nose, etc., I had no idea what would cause this to happen. We had just moved from Oregon to Tennessee and these symptoms started to increase. I found a primary care physician in Tennessee who referred me to a rheumatologist. It was very confusing to me because I thought my issues were related to my gastric bypass surgeries. This was the first time that I became aware of the fact there's something more going on with my body. This rheumatologist didn't want any of my previous health history or what led me to his office. He discounted any previous health care I had received and basically said I was a new patient to him. We were starting all over. He ran a bunch of tests for a few years prior, and including these tests, the lab result that was always high was rheumatoid factor, which is indicative of an autoimmune disorder. And he also gave me a chew test that indicated potential Sjogren's. But everything else came back normal. As a result, he diagnosed me with fibromyalgia and sent me back to my primary care physician. I requested a second opinion and visited a rheumatologist at Duke, 4 hours away. He vowed to stick with me to get answers. He ordered a lip biopsy. The lip biopsy came back negative, and rather than stick with me to find answers, as he had promised, he referred me back to my primary care physician. I wanted answers to the cause of the pain and extreme tingling in my arms, hands, feet, legs, face. Nobody could tell me what was causing that. My PCP then referred me to a neurologist. The neurologist ran a bunch of tests and determined I had both peripheral and sensory neuropathy, and after skin biopsy, it was determined I had small fiber neuropathy. We were having issues accessing to specialists in Tennessee, and we decided it was in our best interest to move back to our home state, Oregon. My husband had to leave a job he loved, but we hoped it would be better here. But it turns out specialists are hard to come by anywhere in the United States these days, unless you're in a big city. As stated previously, you may end up waiting for months to see a specialist. My new primary care doctor referred me to a new rheumatologist who ran more tests. He diagnosed me with Sjogren's. Tests or not, I had all the symptoms for Sjogren's for years, but went undiagnosed. It is not clear which came first, Sjogren's or SFN, but they are closely related. And the time gap between the first Sjogren's labs and the most recent was 3 or 4 years. So after so much time without treatment, it felt like Sjogren's was traveling from my mouth down through my digestive tract and out the other end. It is my belief, not based on anything except for my experience, that a combo of SFN and Sjogren's was damaging the lining of my internal organs, esophagus, intestines, bladder, colon, etc. There is obvious damage to my mouth, which has resulted in losing several teeth. My mouth is both burning and numb. I eat several 32-ounce tumblers of ice about 6 times a day. I try to use over-the-counter remedies to improve my dry eyes and mouth. Doesn't really help. Also, I now strongly suspect my chronic UTIs are related to dry lining of my bladder and inability to evacuate urine completely, which sets me up for frequent UTIs. Fortunately, and I'm so thankful, my new rheumatologist that diagnosed me with Sjogren's also put me on hydroxychloroquine. And for the first time, I had a positive outcome from taking a medication. It was only about 20%, and over time it lessened a little bit, but I got some symptom relief. I am now considering IVIG treatment. The biggest learning lesson for us all is if I had received the Sjogren's diagnosis and hydroxychloroquine when I saw the first rheumatologist years prior, I might have been able to work for a longer period and I might not have had so much damage to my body. Turns out I have more than just SFN and Sjogren's, and that's for another time or another post. So what are our takeaways? Don't disregard your symptoms, even if you don't have a diagnosis yet. Don't ignore it and write it down. Work with your doctor to get a diagnosis that makes sense. Continue to look for a care team that is willing to go to battle for you. I fired the first rheumatologist because he was rude and didn't take me seriously. I love my new rheumatologist because he listens. People relate Sjogren's to eyes, nose, and throat primarily, but it can impact your organs as well. And when it does, it's really difficult to handle. You may have a primary or secondary diagnosis that is closely related to each other, just like Sjogren's and small fiber neuropathy are closely linked together. Now I have the Sjogren's diagnosis and SFN, and it's looking like I might have a blood cancer as well. So I have some questions about that. That's for another video. Message me if you have any questions or something doesn't make sense. Have a good day.